Dr. Patel, let's talk about missing teeth. And quite often, we, the people, when we have a missing tooth or two or three or whatever, and I'm usually talking about missing teeth in the back because obviously a missing tooth in front, we run to a dentist rather fast, it's ugly. But in the back, not so much. In the back, we kind of, well, yeah, it's missing, felt uncomfortable for the first week or two, but then not so much anymore. And as you can see, I must have had that myself. Otherwise, how would I know it feels uncomfortable only for a little bit, and then you kind of adjust to it. Yet, dentists keep telling us all havoc will break loose if we don't fix that missing tooth and replace it. Not fixing it, replacing it. So shed some light on this discrepancy we patients seem to be having. On one hand, doesn't seem to be a really big deal. You guys keep saying it isn't bad, it isn't so good, and you need to replace it. We sometimes feel you guys are just trying to, well, that's how he makes more money. And how explain it and give me your viewpoint on replacing missing teeth, the importance of it.
Missing teeth in the back is what your question was, and missing teeth in the back really are important only to be replaced if they're in the middle. So let's say the very last tooth in your mouth is missing. Do you need to replace it to be able to chew, live life comfortably, all of those things? No. If you are not to replace it, if there is an upper tooth that is there, that tooth is definitely going to migrate downwards towards the gum. And therefore, that tooth is going to be lost over a period of time. Hence, if you have a missing tooth and you don't replace it, you can get migration. It could take a long time, though. And is it necessarily important to replace it? I wouldn't think so. So it depends on what your needs are. This is exactly the way I would explain it, that over time you're going to lose one more tooth if it is the very last tooth in your mouth. If it's in the middle, however, in the middle of your arch, then it is important to replace that, because now you're talking about 5 teeth being affected. The tooth in front, the tooth in back, the tooth on the top, and therefore now there are 5 teeth that can be affected by this missing tooth. So there are simple ways to replace a single missing tooth in the middle of an arch. You can simply wear a retainer if you don't want to spend a lot of money. Retainers.
Let us go into that a little bit later of how we can fix that. Let's stick a little bit more with, like, okay, so another tooth comes out. Is there some type of chain effect? I mean, how does it affect my life simply because there is a missing tooth or two for that much? Or, or
it
as
doesn't.
you said...
Like I said, it does. If it is the very last tooth in your mouth.
In the middle. Let's take the one in the middle. We got rid of the one in the last. We now know, and that I'm sure that's a big consolation for lots of people out there that they go, oh, well, it is the last. I really don't need to worry so much about it. Now let's talk about the ones in the middle, right here somewhere. And that one is missing. So
if it's right, yes. If it's right there in the middle, what is going to happen is the neighboring 2 teeth are going to start migrating. Okay.
Meaning they start shifting, they start getting crooked, like a fence pole. There's nothing to hold them.
They start shifting towards the space.
Mm-hmm.
They start shifting towards the space. The bottom tooth starts shifting upwards towards the missing space.
Mm-hmm.
As the bottom tooth starts shifting upwards, there are spaces in between the bottom tooth and its neighbor start forming. So now there's food infection problems there. So now this is why the whole segment of that side.
And when you say food infection problem, we're talking
food setting
the stage for a gum disease.
And decay, because if food stays between your teeth, then those teeth are going to be decayed. So I would suggest that something needs to be done when you have a missing tooth. I would definitely suggest strongly that something needs to be done when it's in the middle of the arch.
Got it. Now let me ask you a question.
You should do some sort of restoration.
Right. Let me ask
Otherwise you have...
let me ask you a question. I've heard that when you have misaligned teeth, which it looks to me when they start shifting, migrating as you call it, that somewhere the whole thing starts being misaligned. It, it makes sense to me that it does. You tell me whether it is so or not. And I have heard that misaligned teeth, which could come because of a missing tooth, but there are other reasons also, could potentially mean that the jaws here, which, the jaw bones here, which seem to be the most sophisticated hinges in the body, they start not working. And again, that kind of cannot be good, like cogwheels in a machine and stuff like that not working well. And that because of it, people actually could get major, major headaches, migraines, and many, many times never know that the migraine comes because of a misaligned mouth. So my question is, could missing tooth, the way you explained it now, in the middle, not so much in the back, and all that happening and it not getting fixed, besides that you said it could create gum disease, it could create decay in the tooth in itself, and gum disease, is, you talked about it in another video, is an enormous liability for life and for the body.
Right.
And it could also create the headaches. Never mind, they're not so chewing so good, and maybe some pain and all kinds of other things. So is this migraine
Right.
thing a possibility of it? Shed some light on it. Tell me about it.
Yes. What happens is when you have misalignment of teeth, the teeth contacts change. When the teeth contacts change, then there's deflection of your jaw, and therefore your joint starts getting off. And once your joint starts getting off, that's when you start getting migraines and you get TMJ symptoms, and then you require more work and you start wearing splints, and then you need more restorative work, and as a consequence of that. So what we call it is a first contact changes, when the teeth move. So when you close your mouth, it doesn't close correctly like it used to before. It deflects off the moved tooth and therefore causes problems with your joint.
Got it. And then those migraines and stuff could come about, and obviously they affect life very much. A person with migraine, he's irritated, he can't do the job as well, he gets asked to go out
Plus,
for a
they're
movie.
taking medications all the time to control those headaches, not knowing why the headaches are occurring. And
Right.
medications like Tylenol, for example, if you take it all the time, can cause liver disease. So there are a lot of manifestations that occur from what you are doing to yourself.
Well, it looks like whoever was the creator, and we have different beliefs of who is the creator or whatever, but one thing is for sure is, there's apparently some creator out there, but whatever he did with this little round thing here, he put a lots of important thing in it, the eyes, the brain,
Yes.
the ears, the nose. So what makes us thinking that he put teeth in it and says, well, let's put something totally unimportant in it, only good for looking good, which, by the way, as you well said, looking good, is an important part in our life today, because not looking good probably doesn't get you the next job, physically, literally.
Well, to add to your statement, I might say to you that your teeth are the gateway to your health. Without
Right.
your teeth, if you know anybody that's 103 but is walking around and is sprightly, then look at their teeth and they will have them. Those are the people that
Interesting.
have good health at older age, is the people that still have their teeth.
Right. So it's
So
definitely not about. So basically, if it's maintaining your teeth, because there's the blood vessels are right located here. It goes into the whole blood thing, and the structure. So you were saying there's a correlation between old people and good teeth, and bad teeth and not so old people.
Well, in my lifetime, in 34 years of practice, I have seen many old people. And the ones that I have seen that walk to my chair, and I have a 103-year-old, believe me, she walks to my chair, she comes in for hygiene every 3 months. She just turned 103. she has every tooth in her mouth. And then I will see a 67-year-old who has no teeth or very few teeth, and he has diabetes, he has blood pressure, he can hardly walk, he has pain in his joints, he has all kinds of diseases, and there is definitely a connection between your teeth, your gum health, and your general health.
So
If you have
while that statement, that example you made may be anecdotal, it is, you have seen it, and by the way, you're not the only doctor who tells me that. You have seen it often enough that you go, you know what, there's something to it for sure. And of course, the clinical evaluation makes sense with it too. Well, Dr. Patel, very, very interesting, very informative. I'm sure people like to hear not to have to worry about their last tooth, but when it's in the middle, go and do something, because yes, even though it may be very slow, but it will happen, and at that point it will be usually more work, more money, and you already had the deterring effect on the rest of the health, which is difficult to do, difficult to fix. Like a liver, because you take Tylenol, is much more difficult to fix back than a missing tooth in the first place, right?
Yes, that's right.
Thank you very much, Dr. Patel.
Thank you.